TNT Open Mind Insights brings you powerful, authentic conversations, illuminating the path to better mental health care for all.
Dr. Patricia Riba. I'm really excited to have this opportunity to get to know you better and the work that you do. I understand that you are the CEO of Dr. Patricia Riba Health Club.
Dr. Patricia's Health Club, yes.
Dr. Patricia, yeah.
Yeah.
And,
no, we have a lot of names, so
yeah.
I'm sorry to throw you off with that.
Right. And you're primarily trained as a pediatrician, but you've here in Orange County, you've done so much work in the mental health space, really developing a lot of creative, models that have had a lot of success with bringing in nutrition and mental health and underserved children that don't have proper nutrition and programs in obesity. There's so much you've done. Tell me a little bit more about the work that you do.
So, boy, it's been a labor of love, I'll tell you that. I am a board certified pediatrician, and I actually started off at Orangewood and Juvenile Hall, and but then became the first full-time pediatrician at Huntington Beach Community Clinic. And we immediately, back in 2002, when I was just a baby pediatrician, I just saw this huge gap in children facing obesity, and what I found was that there was no place to send them. There's no multidisciplinary programs, and so I really didn't know anything about it, and so we applied for a grant through First Five, and we assembled a multidisciplinary team, and we just started tackling these cases. And I would say we had two patients very early on that lost 95 pounds in the first 9 months of treatment. So this was very exciting. But we really found out that these cases had nothing to do with nutrition and portion control and exercise. It really had to do with the social disparities of health. It had to do with trauma. It had to do with depression, anxiety, family dynamics, connection at that young age. And what we found is that if we walked with these families and really learned from them, we could really serve them. And so we had this multidisciplinary approach, and we ended up with a 91% success rate in treating obesity. And we never put anyone on a diet. And we worked with them from all these different disciplines. And what I found was that we really learned from our families what those barriers were and how to help bridge them. And mental health was a huge component that I was kind of blind to. And we used to use mental health providers to help us support our families. We used to have them on our team, and they would either say they need medicine or they don't need medicine. And we're like, well, we need a little bit more than that. And so then we would refer them to mental health providers if we thought they maybe needed medicine. But then when the pandemic hit and we had no place to send them, we thought, okay, that's when I was like, okay, I got to learn this. And so I went through the TNT program at UCI and actually learned the skills that it took to start prescribing the medications and really to understand the mental health, so that I could start doing it myself to kind of bridge that need in the community.
You shared that you didn't use any dietary, programs to adjust the diet or the carbohydrates or soft, Coke and soft drinks. How'd you do that?
Okay, no, we did teach them about nutrition.
Okay.
And we did work on food access. Many of them were food insecure.
Right.
But it really had not, we didn't say you have to have this many calories, you have to have this many carbs. We taught them the value of nutrition. We encouraged family meals, and we really worked on the psychology of feeding kids. There's this woman named Ellen Satter, and she's amazing. She's a registered dietitian, I don't know if you've heard of her, and a social worker, but she came up with the psychology of feeding kids. It's called the division of responsibility, and it teaches kids and parents to have this healthy relationship with food. And so you basically put a variety of healthy foods in front of the child, and then the parents are in charge of what's being served and when. And the children are responsible for if they're going to eat and how much. So you don't say, eat it, try it. You let the kid decide if they're going to eat and how much. So I tell parents all the time, I'm like, you sing the Frozen song in your head all the time. You're like, let it go. Don't make comments. Because if you coax a child to eat a food, they're less likely to eat that food the next time it's offered. But we really taught families, instead of having cheese puffs or sodas or junk food, to really have, to find ways of getting healthy foods in front of their children and to understand why. We want to put natural foods in front of our kids and let them self-regulate. I've been doing this for 22 years. Never had a kid come in with a stomach ache. Oh, Dr. Patricia, I had too many Brussels sprouts, too many apples. If you give kids normal, healthy, natural foods, they don't tend to overeat them. But the fake foods, the foods that are sold from companies, many times those foods are hard for us to regulate. So we just try to swap those out. And then when we find that families struggle to get rid of certain foods, there's usually some sort of emotional connection, a misunderstanding, and so forth. And so we kind of walk back, okay, what is the deal with soda? And then, you'll all of a sudden find out, oh, my grandmother and I used to have it on the stoop back in, our country. And so then you see that emotional connection. Well, what else did you do with your grandma that was emotionally, connecting?
Yeah, I saw that, you start working with children from 0 to 5.
Yes.
As a pediatrician, you're the clinician that the family's going to come to for their vaccinations, their well-being checks.
No,
and all.
not anymore.
Not
all
anymore.
I do is the nutrition-related issues.
Okay.
And so most of the time it's obesity, sometimes it's underweight, and now we treat the whole family to the point where now we've got many of the insurance companies sending us adults. So I have like 0 to 79 in my practice now.
Got it.
And so all we do is meet families where they're at. We meet people where they're at, and we look at the whole person. We look at what they're eating, what their relationship with food is, their exercising, their headspace, their screen time. Oh my gosh, their screen time. And so, and then we look at their mental health and how they cope. I mean, if you're stressed as a child or an adult and you're using food and screens to cope, guess what? You're going to be overweight.
I think you're talking about me.
Sorry.
That's what I'm doing right now. Yeah.
So if you're using food and screens to cope, then obviously, and it's part of our culture. If you're watching a rom-com and the girl and her boyfriend break up, the next scene the girl's drinking and having ice cream and she's watching TV and she's crying. So with her girlfriend or her cat. So this is part of our culture. And so to meet these kids where they're at, or these adults or whoever we're treating, and be like, we're using food and screens to cope. What else could bring you joy when you're feeling down besides those things that might be healthier? And kind of walking with them and working on that.
Yeah, you're an obvious believer in preventative health care, just based on what you.
Yes.
So
the ACEs study is
what you've just described really begins age 0 to 5. In that pediatric office, maybe that pre-K kindergarten class, where people are getting, a 3-year-old, a 4-year-old. What more do we need to do? You have a specialized program that people are referred to you, but we need to start working on this well before you.
Yes.
What do you envision we should be doing? I mean, training more pediatricians, training teachers, school districts. I always hear they're dabbling into this, and they appreciate that what you're doing is the way to go, but we have a long ways to go.
Yeah, no, I know. And that's what my dream is. And we have a huge project right now that we're working on, and that we have a grant. It's been voted on and approved. We haven't gotten funding yet. We're working with UCI to do the research on that, but through LA County Department of Mental Health.
Yes.
And we have an 8-pronged program, and we're trying to prove the pilot. And it's for 0 to 8-year-olds.
Okay.
And we want to start up front in kids' lives.
Okay.
And we want to do, it's an 8-prong approach, and it's like either taking kids that are already have these issues and having a multidisciplinary team to address that, but it goes all the way down where we can have like primary, secondary, and tertiary prevention and early intervention. So we have like, we've gotten together people from all different disciplines.
Okay.
We have the top puppeteer in the world, Victor
Okay.
Yared,
Yeah.
and we have like Virgin and Lisa O'Brien, who is she's worked for Disney and with Sesame
Okay.
Street.
Sure.
So we've put together like a children's show. It's called Cucumakaluka, and it's this program called Being Healthy from A to Z. So we use the letters of the alphabet to inspire these kids to eat, to be more healthy and to deal with their emotions. So we'll take a letter, like the first one, and it's all with birds because I was this close to being an ornithologist.
I heard about that. Yeah. Right.
So we'll have like these. So these birds and I live on this island called Cucumakaluka, and the first one is about Brock, who is this green bird that has a little ADHD. He's like crazy about vegetables, and he's feeling angry because somebody abducted his asparagus. So of course it's the letter A.
Right.
And so he's, and so Pathy, our peacock on the island, who's very into emotions, she's like, well, why don't we do some ah breaths? And so Brock does some ah breaths. He feels a little bit better. And then Boogie, our blue-footed booby, he loves to dance. And so he says, well, why don't we do air guitar or some arm circles? And finally, his favorite aerobic activity, which is dancing. So then Brock is feeling even better, but he's still feeling better, but he's feeling hungry. So then we go in Chef Diego's kitchen, and next thing we know, we've got apples and almonds, and guess what? Chef Diego made asparagus fries. Nobody would steal on Cucumakaluka. So he basically feeds him the asparagus, and Brock realizes nobody would ever steal from him. He gets his superpowers, and he's happy. Everybody's feeling good inside. And we talk, and he uses art to show how his friends helped him when he was feeling angry. And we talk about how art is a healthy coping mechanism. And so we use this letter A, so we're teaching literacy. We've talked about a bunch of different fruits and vegetables and even almonds, all foods that are healthy, that are natural, that start with the letter of the day. Different activities you can do when you're feeling angry, and that being angry is okay. And so we take all these concepts and we tie them into literacy and make them fun with these wonderful puppets.
You mentioned, a program proposal grant that you're, hopefully at the cusp of starting, maybe with UC Irvine. Is this to actually go into the front line, like into like pre-K classes and so forth, and begin to pilot some outcomes? And
so we already have A and B pilot. We already have that out on YouTube. It's free. But the goal is to pilot it and get one for each letter of the alphabet to have 26. And then we'll be doing this. We've already done this in 25,000 students since the pandemic came out, and we'll be doing it all over LA County and getting feedback on it. We have so much fun with the kids, and the puppeteers are comedians. They're amazing. They're so funny. And the kids now that they've seen that I'm on YouTube, I get like celebrity status.
I'm sure.
But and we have books to go with it. So, and then which books are amazing because then that's a mindful way of bringing these concepts home. So we have to reach them through videos, but then they can bring a book home, and they have these books about these characters. We have a website, and we're already in 4 languages. We're in English, Spanish, Arabic, and Korean already, and we're working on more as funding comes in.
I'm trying to like envision this. My kids are older, 31 and 28, but we have nieces and now grand nieces. Are we talking like 2-year-olds, 3-year-olds, that pre-K class? When they sit down, they like this video. They would all sit down and watch this video with their instructor for like 15-20 minutes, and then they would keep building on that.
Well, yeah, the way we've done it, when we've done in-class programs, we tested it with a bunch of different ways, but they'll see the video, and then we'll talk about the video, and then we have workbooks that go with it that the teachers can continue to give these lessons. But what we've also done is, I have a friend, Stan Fraser, he's from Sugar Ray, so he gave us some great music, and so we have a little bit of adult humor also in the video. So we're trying to even have those videos come home, and those messages come
Am
home.
I correct about the age? Like 3 years, 4 years,
So
or
the first 2 years, we're
Okay.
starting with 3 to 6 year olds.
3 to 6 years old?
And
Okay.
then it's a 5-year program where we'll be incorporating 0 to 2 and finally 7 to 8. So the goal, it's so interesting.
Yeah.
It's like we started this during the pandemic,
Yeah.
and it's because I was seeing the obesity epidemic and the pandemic like come
Yeah.
together, and it was scaring me. I could just see it
Yes.
happening.
Yeah.
And if you look at the data right now,
Right.
the one age group that has gone up in obesity more than any other
Yep.
age group, 4-year-olds.
Okay. Yeah.
And so we're like right there. We were on the
Okay.
front line seeing it. I knew it was going to
Yeah.
happen.
Yeah.
And so we started creating this then.
Okay.
And so we'll have all these supports, plus we'll have support systems for other providers so
Right.
that we can train them in this. So it's basically you're going to have this version like a wannabe Sesame
Yeah.
Street, whatever, Mr. Rogers, video series, school-based programming, books, and then this treatment team who's also teaching other doctors this. So basically this amazing treatment program that's trauma informed all the way down to our version of this, video series, all speaking the same language and all doing this hopefully this shift in the whole culture. And then we're using UCI to do the research on it and writing white papers and trying to really change how we're looking at this upstreaming kids' lives instead of waiting until these diseases happen.
And what have you noticed on the impact of their siblings, their maybe older brother, sister, their parents in the home that haven't been eating well and in these, food deprived areas, the inner city? I mean, I'm imagine their habits are changing. You're focused on the
No,
child,
we're doing the whole
but
family.
they're all
And the
okay.
extent and the grandparents too. And that's
Right,
what
right.
our whole team has been focused on, the whole family. We're always like, who's cooking and so forth. So we're already kind of locked and loaded for that.
Right.
So as we do our programming, we're looking in neighborhoods to find grandparents and parents that can help advocate this program in different cultures and different languages and so forth, so we can really bring these messages home and make them meaningful for families, because we want this to be a huge change in the culture.
Tell us the story. I mean, you're an expert now and you're doing great work, but where did this all start? What was the flame when you were younger to go in this direction?
Okay, well, oh boy. Okay, so number one, I should say, so if you would have met me when I was 5,
Okay.
And you asked me what I wanted to be when I grew up, I would have told you I was going to be the next Jacques Cousteau of birds. I love birds. So we used to find we'd find a bird that had fallen out of the nest, and we found one when I was about 5, and we took care of it and we let it go, and it lived, and it was wonderful. And so after that, I mean, sometimes like in 3rd or 4th grade, I'd come home like an hour or 2 late because I'd be looking under all the trees to see if
There's another bird.
And then I found out you could get eggs at like Magnolia Bird Farm, and so I would do that. I would raise eggs, and I think I was the only girl on the street that had a duck. And so I rehabilitated. I have a huge aviary in my backyard. I have pigeons with broken wings, you name it. So people still bring me birds that have fallen out of the nest. So birds have always been very special to me. And so, and then during the pandemic, I was so struck by all these kids who I was taking care of, and we were shifting so much. We're seeing these families, and these kids were they were struggling to learn. Their families were struggling to get food. Some of their parents were they were going through cancer treatment, and they couldn't find food, or they were scared. And we were just, my brain was exploding. I'm like, how are we going to help these families and these kids? And I'd always had this dream about writing a children's book about this girl who lived in this tree house, and she could almost like Lucy, from Peanuts.
Right.
And so I was walking my dogs and found this random, never seen it in my neighborhood, this beautiful tree house that overlooked the ocean. And I was and it just came to me. I was like, that's my inspiration. I'm gonna write that book. And I'm gonna and then I started thinking, okay, what am I gonna name it? And there was this. When I was 4, my mom used to play tennis at this place in Corona del Mar, and there was this little patch of ice plant, and my friend, when I was 4, we would play together in this little patch of ice plant, and and we pretended we were princesses, and there was a king that was going to come, and it was just this little nothing. There was like a rock, and there was like a little palm tree that was nothing, and the caterpillars would be like, you know, whatever. And we would pick flowers and make wreaths, and we had the best time. And we called this place Cucamongaluca.
Right.
And it was a made-up word. And I don't know which one of us, if it was Rosemary Hamlin or myself that made it up, but that was our name. And so we'd be like, are you going to play tennis at Cucamongaluca? Because we're going to go. And so that name stuck with me. So I thought, that tree house, we're going to name it Cucamongaluca. It's going to be birds, and it all started coming together. And so it was like, that was literally in April. I mean, the pandemic started in March. April, May 2020, May 2020, we were doing distance learning with the first batch of kids at that were distance learning for Santa Ana Unified, and they were learning the letter D. Right. And so we're like, can we come in? And we just did a little PowerPoint. I think we had some puppets from like Amazon. And it was the letter D, and I remember thinking, oh, D's so hard for like vegetables. We're like dragon fruit and like, you know, dill pickle. Like we didn't know what to do with that. But remember, the kids really liked Pathy because we basically said, how are you going to use, you know, we want you to learn to use the letter of the day to be more healthy. Yeah. So you can use the letter D to be more healthy when you're feeling down. You can draw a picture of your day, you could play with your dog, or you could dive in your pool. And so we had all these little pictures, or you could eat a dill pickle, or you could turn off your device when you eat dinner. So we had all the birds told us the different things. The one in charge of the devices was our guy in charge of safety, our crow. But Pathy said, you know, you could draw a picture of your day, and if you were feeling down, and the kids just loved that.
What I just heard in your story is imagination. You have to unleash imagination. And I was connecting it to the work you're doing. We have a responsibility, these young children that have challenges, we've got to unleash their imagination. I mean, imagine if every child could really just think outside the box in anything they want to do. I mean, the power of I think in 1 month, our whole world would change. If every child has the opportunity to not worry about food or where they're going to sleep, or the well-being of their parents, is it safe? I mean, that's the most powerful thing that could happen. So the imagination you just shared from when you know, that made me feel like a kid again too. Because I think imagination and opportunity is at the basis for solving any challenge that we have. So
well, and that's why we love the puppets. Yeah. When we designed the puppets, we worked with this puppet designer, and I said, design me these puppets, but then show me how you could make this puppet for less than $1, that any kid could make this puppet. And so he designed these beautiful puppets for us. And so Brock and Pathy and Boogie are beautiful. But then he showed me how with an envelope you could stick your finger in, and you could make the beak, and you could make a puppet. You could make how it would be colored in. And so we show the kids how they can go home and make these puppets. And when you use a puppet, you start using your imagination, and kids can work out their feelings, and it can be a beautiful thing.
What are 2 or 3 things you would like to convey to decision makers, be it legislators, be it school districts? You know, I like to make things move fast, especially as I get older. I don't want to wait 10 years or 15 years. What do we need to do now in the next 1 year as you continue to do more outcomes and look at data? What do we need to do today to start implementing these kinds of ideas at the earliest age? What would you tell decision makers or superintendents of school districts? You've got to start doing this now. What comes to mind?
Oh, gosh.
2, only 2 or 3 things.
Yeah, I mean, I'm just like, open the doors to funding us. I think that's the big thing, because we've been sitting here, we're locked and loaded, and we're stuck waiting on the boats to be let in. You know, we've been working with schools, and we're waiting for the funding to come in.
Do you think there's some things you can do that aren't necessarily just funding based, i.e., maybe they need a little change in their curriculum. Maybe they need to take away something that they think is crucial, and maybe 1 hour a week in education on nutrition? Like, 'cause sometimes it's tough to keep asking for monies
Yeah.
because everybody wants
I
monies.
agree.
But what about redistributing? The, thoughts along those lines? Like,
Okay, so there's been a couple of things that have been my pet peeves
Yeah.
with schools that I feel like there'd be to really buckle down and find ways of making money without selling junk food. They all have it in their
Yeah,
wellness
okay.
policies, but none of them follow it, or they find little things. Oh, we only started selling after this time, and they still sell the chocolate bars. So finding healthy ways, like doing more jogathons or other ways that promote health instead
Okay.
of selling junk food, which I know it's low-lying fruit, but it doesn't do anything good for the kids. There's really no reason to have chocolate milk in the schools. There's no reason. People fight it tooth and nails, but there's nearly 5 teaspoons of sugar in chocolate milk, and so to have the white milk instead of the chocolate milk, and have water as an option.
Right.
I know there's money involved,
Yeah.
and there's all kinds of things, but
Yeah.
those are you're asking for simple changes, and then also having schools have them have recess first and then eat. Kids are more
Okay.
likely to eat better. And I tell my parents also, just start offering, add a fruit and a vegetable to all meals and snacks. I think
Right.
that's a really nice
Right.
thing. Just a
We
fresh
can do
fruit.
that
Those
now,
are
today.
basic things.
Yeah.
But I don't know why kids can't be offered water at school. I know that money's involved, I'm sure.
Right.
But those are just some basic things that I think would make a big difference at the schools.
You mentioned earlier the Train Your New Trainers program. Tell me a little bit more about how you value that and its importance to you.
It has been probably the single most important thing that I've committed to doing since since I've left my training in school. I've always been looking for gaps in the patients that I've taken care of and what their needs are. And I feel like being able to fill this gap in mental health for my patients has been the most valuable tool I've acquired. And because there's this big wall for families and patients to get into mental health.
Yes.
There's big waiting lists. And then when they get in, there's a ton of rules.
Yeah.
And it's like, oh, well, we will only give them mental health for a year. Or they'll get on the waiting list, and then they're just happy to get the first appointment. And by the time they get it, like, you finally talk them into wanting mental health. They're like, oh, we don't want it anymore. It's, so there's, or they have so many rules. Well, that's not how medicine works. People need to be met where they're at.
Yeah.
And so I like that I'm equipped on the front line, meeting my families and being able to speak with them at any point in time about mental health issues and being able to manage those. And then, hey, if something comes up and it's out of my jurisdiction, it's more complicated, I have the backing of these amazing faculty members. I mean, they're board certified in pediatrics and psychiatry and substance use disorder. Many of them have the ones, because I'm doing both of the programs. So I mean, I have this backing to get help all the time. Like, on a daily basis, I can hop on a call and get help from top people.
And let me add to that, Dr. Patricia. You educate the TNT program too with what you just shared today. We also need training in the importance of what you just shared. So it's a two-way street. We're going to train each other.
Well, it's been amazing, and it's really helping me serve the population. So I'm eternally grateful, and I just think we need to have more of us, and we need to get in leadership positions, because we're truly filling that gap. You can call a surgeon and they will call you back. You call any other specialist, they will call you back. You call a psychiatrist, and then you call a psychiatrist, and you call a psychiatrist. They don't call you back. It's the only specialty. So if we can be in some of those positions, we can help collaborate care.
Well, keep up the great work you're doing. This was a wonderful story. I learned a lot, and you energized me to keep being creative in the people I work with. Thank you so much.
Thank you.